Hi, I'm Yvette Bodden, host of the AW Confidential podcast. Today we're exploring awareness and education and how we can empower us women in making informed decisions about our health. And to help me have this very important conversation is Dr. Jan Katsnelson.
Yes.
Perfect. He is the founder of Fibroid Fighters and a cardiac surgeon. He is here to help us expand our awareness and empower us with knowledge. Thank you so much for being here today. I appreciate all the work you're doing as a patient of fibroids myself. I understand how painful it can be just emotionally, physically, and the detrimental effects that fibroids can have. I don't think there's enough awareness around that topic. So you founded Fibroid Fighters with a mission to change women's healthcare. What made this a fight that you couldn't ignore?
So being a heart surgeon, I really enjoyed saving lives and magic of something broken heart and fix it. Then I learned that it's possible to do extraordinary improvements of health through tiny minimal invasive procedures without any significant risk like heart surgery. I started with the vein treatments and then we progressed to treatment of other vascular problems. And I discovered for myself how often women suffer from fibroid disease. Fibroids are benign tumors in the uterus, and 70 to 80% of women by age of 50 suffer. That means like 30-40 million women suffer significantly. To ask for treatment, 1.2 million patients have a treatment that probably should not be done, surgeries.
And I've read a little bit about hysterectomies, which is
terrible.
It's terrible.
And what we do in the clinics, we have clinics in more than 30 states called USA Clinics, and we have USA Fibroid Centers specialized on the treatment of fibroids. We do minimal invasive treatment called uterine fibroid embolization to shrink by decreasing blood supply, like stop watering the plant, decreasing blood supply to the fibroids. We can just shrink them and fix it. Doesn't matter 1 or 30, and nobody knows about this. So I thought that we just need to involve everyone to bring awareness and make patients knowledgeable and make a better decision.
Well, knowing that there are options out there makes a huge difference. But if no one knows, then those type of treatments go unnoticed and women continue to suffer. Now, there are many women who live with fibroids. A hysterectomy is often presented as a solution. And I want you to sort of, and I have to say it's your opinion, right? But why do you think the lack of options go unnoticed? Because honestly, I've been a patient of fibroids. I've never heard that before.
So you touched even bigger problem. There's many ways to skin the cat, right? There's different options. Over the last hundreds of years, many treatments were invented for the same disease. Some very old, some very new. And usually new treatments so much better. No incisions, no suffering, immediate recovery, better results. But to differentiate older treatment, newer treatment, the discretion is given to doctors because the licensed profession, they should know. But there's a well-known fact. It's actually not really a doctor who makes a decision. The decision is pre-made by a patient. Each specialty doctor, the patient chooses. If doctor goes to doctor who does big surgeries, most likely recommendation will be surgery. If doctor goes to someone who does minimal invasive treatment, recommendation will be to consider minimal invasive treatment. It's unbelievable, but that's in their workings, how it works. People recommend what they do, what they're familiar, and quite frankly, what they get paid for sometimes in this country and everywhere. So, if you go to, and it's about whether it's cardiology, urology, like different specialties, that's the situation. So when women go to gynecologists for women's problem, gynecologists do surgery. That's what they've done for 100 years. Myomectomy, hysterectomy, and to me, it's terrible. 1 out of 3 women end up with a hysterectomy. It's like castration. Some women, 25, 27 years old, get hysterectomy. They cannot have children. And after this, the bottom of the pelvis of the abdomen can fall and create incontinence. It's not nice to walk with pants all the rest of their life. 9% of patients after hysterectomy can end up on a drug addiction because of pain and discomfort. So it should not be like men don't get recommendation to cut the balls.
Agreed.
Why would women remove When alternatives exist for 30 years, FDA approved, covered by insurance, even managed Medicaid. That's why, I cannot argue with all the doctors. They do whatever they do. I have no control, but I have a control what we want patients to know. So we just want to tell patients, this is the right way and this is the old way.
And I think the fact, and I have to say it, that you are a man and you're doing this work for women is, to me, shows that you really care, because most men, it's like, she's a woman, she'll be fine. There's sort of a lack of empathy, I think, sometimes. Disagree?
Allow disagree. I think happy wife, happy life, everyone knows it. Miserable woman, terrible life.
True.
Man, I'll turn table. I think the blame is on women. Women actually like a superhuman. They do everything that men do and so much more. And they have periods. Fibroids is so common, 70-80% of women suffer from this. That means they suffer, the sister, the mom, the aunt, the grandma, everyone suffered. So you can be in the misery and complain, or just suck it up and move on. And it's progressive disease. It's very difficult to understand what is normal. If everyone suffer, is it normal? Is it disease? So women get to push out their own concern. And it's an uncomfortable topic. Men will not say, like, how's your period? So I think educating women and men, even from high school, very, very important about this. Even women don't know, what do they need to do? How do you diagnose fibroid? What to do? I think it needs to be like people know. Smoking, not good, right? You can have a lung cancer or other cancers. They know colon cancer, you need to do colonoscopy. Skin cancer, you need to check. Like, people know those things. If you have cholesterol, probably heart disease. And they know what, check blood, do colonoscopy, do x-ray. People understand that. But they don't know for fibroids, just simple ultrasound. Takes 5, 10, 15 minutes, with the transvaginal, transabdominal. Most likely will give a diagnosis, yes or no. And the treatment, like when someone suffer, typically with a 1 or 20 fibroids, the fee is universal. You just stop watering the lung. Blood supply, increase blood supply to fibroids. It will universally work for vast majority.
So you shrink. They shrink.
Yes. And it takes 30, 40, 50 minutes. Hour, 2 hours later, patient can go home and then just needle hole. That's all. Remember, it's tumor. Mm-hmm. Tumor means excessive growth. Excessive growth means give me more blood. And as soon as we decrease the blood, cells that need it the most, they just cannot function. They die. Normal cells, they survive. That's why fibroids shrink, uterus stays, can have normal babies. It's fantastic.
It's definitely, we need more of that. Now, beyond the diagnosis, there's an emotional impact.
I think it's terrible. It's almost wasted 20, 30 years of life. It's physical pain. It's a social disconnect. Like, you cannot wear white, cannot go out, many times need to run to bathroom all the time. It's weakness from anemia. So it ruins your life, ruins your social life, your family life, reduces ability even to make money. If you suffer, you cannot study, you cannot work. Most people get paid prorated the number of hours or days they work. And if you cannot work for 2 weeks out of the month, your pay will be half. And who will keep you at work?
And I don't think we have these conversations, these honest conversations, and as often as we should.
You can waste 20 years of life, or you can find 2 minutes to go online, usafibroidcenters.com, and just schedule appointment, or similar clinics, get ultrasound, get prior authorization from insurance company to fix it in a week or 2 weeks, have a short procedure, hour later go home. Usually there's some discomfort because of, it's like you stop blood supply, and it usually causes some cramping. And for a couple of days, that's it.
So one of the things that I believe, and it's because it's the reason that I do what I do, is because I believe that having these conversations, these honest conversations and open conversations, can sort of take away the shame, the stigma about, talking about our bodies or our trauma or, all the things that we want to hide. So I think truth is at the core of resolving a lot of the things that we sort of live with. So if there's one truth about women's health that you wish we would all know, or who's ever listening would understand and would hear you what would that be?
Most common problem for women's health is a fibroids. It's 70-80%. So if something wrong with this, it's a very high probability. Do ultrasound. And if you get diagnosed with a fibroids, please no surgery. Try different things. If someone says a myomectomy, hysterectomy, say, no, can I check for UFE? You can Google. Today, everyone has access to information.
And they tell you, doctors tell you what size it is. They measure these fibroids.
It can be 1, can be 20, can be small, can be big as a grapefruit. And these benign tumors, they kill. Maybe not women, but the babies. Because when women have a fetus, baby, it competes with tumors for blood and space, and it usually loses. It's terrible. Some women if they have a baby, right, they go to labor with a very low hemoglobin because of underlying anemia. And if they lose blood, they die too. This is not a joke. This is terrible. It's unforgivable for women not to know, for healthcare professionals not to educate about such a common. If 80% of men would have the problem, I'm sure everyone would be talking about.
Absolutely.
I think women just take too much upon themselves. They need to take control of their health.
Well, I want to thank you personally for the work that you're doing to educate us and bring more awareness. Being here today for me, as someone who has dealt with fibroids, is just we need to be part of the solution, I think.
Thank you for help, and I think everyone needs to learn and tell 10 people.
That's what we'll be doing today.
Just ask everyone to promise, tell 10 more people. Because if you say, if you spread it this way and start those totally normal conversations, so many lives will be improved. So many babies will be, you know what? I have twin daughters. The MD, MBA programs, they're already grown up. When they were in high school, they went to other high school to give talk about fibroids to like 500,000 students. And everyone's like, oh, my mom had it. My sister had it. Boys start, oh, my sister suffers from this. Education is a key. So we'll work together.
100%. We'll educate.
Thank you so much.
Thank you so much for being here today, and thank you for joining us. Remember, tell someone, talk to someone, and let's make sure
Ultrasound, no surgeries.
Ultrasound, no surgeries. There you go.
Happy.
Thank you so much, Dr.
Thank you.
Jan. Thank you.